All right. Welcome to Early Care Connection. I'm Izzy Greenberg. Let's see. We are joined today by our resident panel of experts, Merrill Gay and Ava Bermúdez Zimmerman. Merrill Gay from the Connecticut Early Childhood Alliance, Ava Bermúdez Zimmerman from the Child Care for Connecticut's Future campaign. I'd love to, of course, start by also thanking Sandra for providing interpretation for us. And thank you to you all for being here today, and a big welcome back and good morning. So let's see, today we are going to spend some time talking about the legislative session, which starts this week. And as a reminder to everyone, please use the chat for technical difficulties or for conversations within the community, and use the Q&A for questions for our panelists. We have a lot to go over, but it won't probably be a very long session today. So I will just turn it right over to Merrill and Ava to get started and walk us through some of the tools we can use this session and what to expect. Merrill and Ava, I will turn it over to you now.
Okay, so the legislative session starts on Wednesday. The governor will present his budget revisions, and we'll see how committed he is to the recommendations of the blueprint, of the Blue Ribbon panel. There have been recent news stories that early childhood might get $50 million. Just context, the Blue Ribbon panel called for $148 million. This will be a difficult session as far as finances, because the fiscal constraints that they renewed this past session pretty severely limit how much money they can spend unless they figure out some ways to get around those limits. Ava, you want to jump in with some other thoughts?
So because it's a short session, and what that truly means is what it's in the name, we don't have much time to activate legislators to, do our bidding, work hard for us. The window that we have for testifying and then going right into legislators voting on those budget changes, legislative bills, is very, very tiny. We have to put all of our work into the advocacy starting, ASAP, starting right now. So even though we haven't started the testimony portion of session, we could start doing a lot of the groundwork now with all of you, writing letters, drafting emails, and then, really have our act together so that when the hearing portion, which will be about a week to, 2 weeks from now, when they give us official dates to testify, we could be ahead of everyone and say, hey, we already have, 40 testimonies, 40 stories ready to go, written down, and we have already drafted emails. And when the date really hits, then we can, start emailing the legislators and having that ready to go. So behind the scenes, Merrill, myself, Izzy, our different teams from our organizations are going to be doing that groundwork with all of you. If any of you on this call are not connected to other organizations, some of you are very active in your union. Some of you are very active in the Early Childhood Alliance. You might be connected to All Our Kin, Circle. These are all organizations that do fantastic work when it comes to advocacy and testimony. So if you're not connected to any of those groups, you don't have to join, now if you want to, fantastic. But you could use the opportunity in today's call to learn some tricks of the trade, maybe join the CCSCT call on February 21st to, start learning how you draft your own testimony and how independently you can also submit your story to legislators. So to dive right in, when we send you an email through Early Care Connection or through the Alliance or any of the other organizations that are affiliated, we will make sure that we send you a toolkit that's very clearly stating how you draft that testimony. We keep using the word testimony because that's what the state calls it. But in reality, it's like a personal statement. It's like your own personal story that at the end of that story, your messaging, what you say is connected to how that legislator could use a specific bill or money, if we're going to be asking for money and not a bill, to change that the crisis that exists. For example, I'm going to go hypothetical here. Let's say the kids in the daycare centers all needed for new shoes for all the kids in daycare centers and daycare homes. But let's use this as a weird example. Let's say we knew that the kids all needed new shoes and we're really into getting them new shoes. Now, typically during session, in the process, if there is a legislator who's totally supportive of those new shoes being purchased, they're going to be the champion, right? They're going to be the person who's going to say, I'm 100% with you. I'm going to fight to the end to make sure that this happens. In that process, they're going to introduce this bill, this legislative proposal, and they're going to get assigned a number. So it's going to say bill number 001, kids get new shoes in childcare programs. So when you say your story, you share your story, well, I had 6 kids in my care and none of them had shoes and they really need some shoes. So, maybe explain how some of the parents in your space have really been asking you and you've been supplementing, you've been buying shoes for them. And you've said your story, you think it's a good story, and then at the end you connect it with the bill. So I really want the legislators here to support this idea because bill 001 gets it done. Please do it now. And that's kind of it. So you write your story, you connect it to the topic at hand. You make sure that you make a clear ask. A clear ask is, I want you to do X, Y, and Z. I need you to do X, Y, and Z. Parents are counting on you. That kind of phrasing. You make sure that you either connect it to the bill number, or if in fact it's money, then specific to money. And then you submit it with signing off your name, what city or town you're from, and then you submit it to the right the right legislative committee that is connected to what you're asking for. So some on the call have done this already. Some on the call are a little, dependent on the organizations that I mentioned to help them do this. But we want to get to a place where, we could all submit a legislative testimony, your legislative story, with not as much hand holding as in the past. We want to become experts in how we do this. So one way to help you do that, I know that Merrill, myself, and others have been talking about this program that Merrill's very good at using called Autocrat, where you kind of fill in the blank, you get an email, you fill in the blank, and then automatically it's helping you map that out. Merrill, can you explain a little bit more how Autocrat and that email system works?
So it's essentially you answer some questions in a Google form in short paragraphs, and then Autocrat is an add-in to Google Sheets that takes your answers and drops them into essentially a mail merge kind of arrangement so that it puts it into the standard format for testimony, where it's indicating which bill you're testifying on. It, it sort of thanks the committee chairs for the opportunity to testify, and then it tells your story by putting in those paragraphs that you used in your answers to questions. It's just a sort of simple way to structure testimony. We'll have that set up, and we'll be tracking when the various committees are holding hearings on bills. The Education Committee will be meeting starting in 20 minutes or so to kind of lay out the bills that they're going to do this year. And what they have on their agenda is an OEC bill, which is essentially some technical fixes, an early care and education bill, an early learning bill, and an early child care bill. I'm not quite sure why they make those two, that separation, but that's what they've gotten in their agenda. We don't know exactly what will be in those two bills. We understand that the committee chairs were like the idea of making staff of early care programs automatically eligible for free childcare using Care for Kids through an income disregard, where you wouldn't have to do the whole income verification for people who came to work at a childcare program, which might help with recruiting if you're competing against retail or other kinds of industries. What's going to be critical in this, this is really going to be a sprint. We'll probably have a hearing on either the 21st or the 28th of February in the Education Committee. The Appropriations Committee will be holding hearings probably starting next week. And then other committees like Commerce and Children's Committee may have bills related to this too. So as soon as we figure out when all of these hearings are going to be, we'll be letting you know. But in the meantime, there are some really important things that you can do to help. The most compelling arguments that we've got are that families can't afford childcare, families can't find childcare, and childcare programs are having so much difficulty hiring staff because parents can't pay enough to be able to pay staff well. And so we need to sort of illustrate each of those points for legislators with stories from people who are affected. So if you've got families on your wait list who have a compelling story about why they need childcare, we need you to help us find those folks who could tell their story. And how do you tell your story? There are two ways to do it. One, using that autocrat tool essentially to do a mail merge of testimony where you tell your story in writing. The other way you can do it is to sign up and testify over Zoom. And my understanding is they're still going to do Zoom hearings. I haven't heard otherwise. It is always a little bit of uncertainty because you sign up through the registration at the committee, and then they do a randomized lottery to pull your name. And so you might get, number 2 on the list, or you might be number 387. And then even then, you still don't know exactly when you'll testify because there might be a bunch of people who don't show up. And so you might be testifying at 10:30 in the morning, or you might be testifying at 10:30 at night. But you'll get 3 minutes and you can tell your story then. Having the access to Zoom as a way to testify is so much easier than having to drive to the Capitol and sit around for hours for your turn. It really does make it much more possible for parents and for childcare staff and directors to testify. But if you don't tell your story, they don't hear it, and they don't know the things that you know. Legislators all try to become experts on all zillion things that get thrown at them. They might be one moment talking to people about homelessness issues, another time talking about tax policy, another time talking about, liquor store hours or something or other, and then you come in and talk about childcare. We need to be able to help them understand this issue, and the issues that you face as childcare providers and that parents face trying to pay for care. I want to show you a couple of maps that some students at Trinity College helped us put together that use OEC data to try and tell a story. It's a different way of telling a story, but it might be something that you find useful when you're talking about the situation in your community. Izzy, can you share the first map around affordability? So this is an interactive map.
Yeah, wait, hold on. Do you want the average family income one, or that's the one you want, right?
Yeah.
Yeah.
Let's start with that one.
Great.
Okay, so this is this shows the percentage of family income that a family needs to pay to afford one child in infant toddler care. Can you hover over, say, Hartford? Okay, so in Hartford, a family has to pay 26% of the average household income to afford one child in infant toddler care. Why don't you go down to, oh, I don't know, Cheshire or someplace.
Let's see, where the heck is Cheshire? Somewhere over here.
Walk it down a little bit below that. That's Southington.
Thank you.
Okay, so in Cheshire, a family has to pay 8.1% of their income. That's, the federal recommendation is that families shouldn't have to pay more than 7%. But, you go from Cheshire right next door to Waterbury. Waterbury people are paying 21% of their income. Yes, we'll put a link to these maps into the chat. And these, if you scroll up, Liz, Izzy, you'll see that this is a Trinity College student assignment. So they did these for a data visualization class. They list all of the sources of information, etc. And if you go down further below the map, you'll see a chart that actually has all of the what's the average cost of care. This is from 211, and then the average median income for the household, and then okay, go down to Stanford. Yeah, we got Stanford further. Is that one? Okay, there we go.
18,200 is the average cost of care, and the average income is 113,511. So 16%.
Yeah. And so, Stanford is one of those towns that has some very rich people and some working class folks. And so there are a lot of families in Stanford who look at 113,000 and say, it's not me, but I'm still trying to afford childcare. This is a useful tool for, we'll use this with legislators, and you could, a parent could, or staff or a childcare program could refer to these things, but it is the story that someone tells that's going to make this real. What are the real trade-offs that folks are having to make to be able to afford childcare? If you're working cleaning offices in Stanford.
So just interrupt to say that you can put your town in as a search.
Yeah.
I'm in Middletown. And so this, you can, if you're not seeing your town in the table, you can search it here. And then there's also a question, Merrill, why is it that the suburbs percentage is less than the city?
Because in the suburbs, people tend to earn more money. So it's, percentage is both the numerator and the denominator. The childcare tends to be more expensive in the suburbs, where it's a bigger percentage of the childcare that's available is offered by for-profit chains rather than family childcare providers. So you may see a difference between, Cheshire and Waterbury as far as the average cost, but you will also see a huge difference in the income levels of, the people in the cities where there's more rental housing versus the people who live in houses on an acre and a half of land in the suburbs.
And I just want to also add in that New Canaan and Darien are the only two communities in the state where people are paying below the recommended 7% threshold on childcare. And so that's just that's out of the 169, we've got 2 of them that are actually below that threshold, but there are also a few where there was not available numbers. I suppose in 211, right? Is that Merrill?
Yeah.
Was it the numbers just aren't available? And so it's not exactly that. Maybe there's 15 of those. So out of 150, let's say there's 2 that are above the threshold, but I would doubt strongly that any of these, if we had the numbers, would be below the 7%.
Yeah. In some cases, there are so few children in these communities that the numbers get suppressed, and you just can't get data there.
All right, you want to go to the next map?
Yeah, let's go to the next map.
Can you see it in the share?
Yes. Well,
Okay.
I can, yeah.
Yeah, if you
So
can.
this map looks at infant toddler capacity in by town. And let's look at Glastonbury.
Okay, where's that? Let's see.
Up a little bit more. You were almost there.
Below, yeah.
That's close, right?
Over.
Where
Kind
is
of
it?
right in the middle. Right in the middle. Up. One more. Over.
So close.
There you
Okay,
go.
there we go.
Glastonbury. Okay, so Glastonbury has 107 childcare infant toddler spots per 100 children. Yes, Tracy, those maps, we will put those maps in the chat. So let's compare Glastonbury with 107 slots per 100 children to, New Britain. That red spot, straight over to the left.
To the left.
There you go. Okay, so in New Britain, there are 13 licensed infant toddler slots per 100 children. So obviously, that makes it hard to find a licensed infant toddler slot. And that's not something that's changed much since my child was, we were looking for infant toddler care for my son 25 years ago.
So over capacity is in green, or capacity 100% or over. They're the green ones. And then where there's not enough to meet the number of children, it is in the red.
In the red and the orange and the, yeah. So you can see that there are, most of the big cities have a shortage of care. And Eastern Connecticut is a great big childcare desert. And what's the gray? Let's see what the gray is. Can you grab?
Gray is nothing. Gray, they didn't have, it's the same
They didn't have
town.
any data?
It's the same towns that are gray on the other map for the most part, not entirely, because there are a few here. I think Kent didn't have any availability on the affordability map, but it does on this one. But there's a significant overlap in towns. Funny though, New Canaan, which, everybody can afford care there, there's not enough care. And as somebody said in the comments, a lot of nannies. Probably.
Yes, I would say definitely a lot of nannies there.
Yep, a lot of nanny care. And then same thing here, you can go down and read more about their methodology, and then you can search by town if you want.
Yep.
So we've put the links to both of these in the chat, and somebody said something about ER visits. Just to be clear about this one, this is just income versus childcare, who can afford childcare in that community. And then this one is how many available slots are there for the number of children. So just to be clear about that.
Yep.
And these may be very helpful to you in talking to legislators. So we wanted this available to everyone.
So, this is one way of telling a story. And for, data nerds like me, it's great. But many other people find a story, a firsthand story about a problem as much more compelling. So we need to find those people who are on wait lists, those friends who haven't been able to find childcare yet, the people who can tell you, look, all my income is going to pay for childcare. You know, I had a woman tell me that half her income went to pay for her student loans and the other half went to pay for her childcare. And if her partner wasn't working 2 jobs, they'd be homeless. Those are the kinds of stories that legislators need to hear. Those are the kinds of things that help people think about, you know, why we need to change the status quo. The time when those stories need to get told will be on us pretty quickly. So now is the time to be thinking about, you know, who do you have on your wait list? Who do you know, do you have a staff person who left because they had a child and they haven't come back because they can't afford care? Do you have, you know, people who can tell their story about the issues with the Care for Kids wait list? We need to be reinforcing the basic arguments about childcare costs more than folks can afford. It's really hard to find. And part of the reason why childcare is so hard to find right now is because there are still so many openings in childcare jobs. Back in November, when we did our last survey of childcare providers, what we saw was that the number of staff vacancies was pretty unchanged from last May. It was slightly worse, but if 1 out of 7 staff positions were vacant, that means that there are hundreds of closed classrooms. We need you, if you've got closed classrooms, to be telling legislators, I've got closed classrooms. I've been trying to hire staff. I haven't found good people, or I hire somebody and then somebody leaves. And what does that do to the viability of your child care center or of your family child care program? The issues of, you know, being able to fill spaces with kids is very closely related to whether or not you've got staff to watch those children.
Merrill, how about if
Yeah.
we have, so oftentimes, a lot of the people listening today have heard from us or other people story, right? Like this might sound like a broken record. And some of you on today might be feeling, I've told my story last year and the year before about how things are really hard for me as a provider, and it's still not quite fixed. You know, what changes now if I tell my story? So like, how about for those people who are just frustrated that it's not quite there yet? Like, what would you say to them?
So democracy can be a frustratingly slow process. It's still better than dictatorship. And so, you know, we're going to keep plugging away at democracy. We understand that legislators are faced with a ton of competing interests. You know, our committee of cognizance at the legislature is the education committee. So anytime we're before the group of people who are supposed to pay the most attention to us, we have to understand that they are also paying attention to the K-12 public school system, which is much larger than we are, and has a relationship with all of the politicians in each town, because town budgets are more than half of their money typically goes to their school system. So there's real pressure on elected legislators to look out for the public K-12 system, because it has an impact on how much property taxes people have to pay back in their towns. So we always have to understand that no matter how important we think early childhood is, lots of politicians will be more focused on the public school system. as something that, you know, they already have a responsibility to try and fund and, you know, provide that for everybody. Early childhood is still, in this country, primarily the responsibility of parents to pay for. We need to try and move the needle on this, but it's only going to happen if we can keep pushing legislators to understand that this is a big problem that still needs to be solved.
On the moving the needle, if providers on this call have been paying attention to the work that all of us, you know, all of us, including your, have done 2 years, you can remember a time where Merrill, Izzy, myself, Liz, Fraser would say, people have told us that there's no chance we're going to get a dime during legislative session for early care, like new money, right? There were legislators who were very keen to give us the same kind of money we've gotten in the past. And because of our advocacy, we were able to get the $200 million. It was a Band-Aid, and we know it's a Band-Aid, but now more and more legislators know that it was also a Band-Aid and are willing to go beyond that. So Merrill just said it's a process and democracy takes time, but we are slowly moving that needle. So if you are considering, and I highly recommend everyone on this call, even if you're here through because of a supervisor, maybe you're an owner operator, whoever you are, if you're on this call, it means that you're in the early care business. You are invested some way or another. So you should also submit testimony. If you're a staffer and you're not the boss, you should also submit testimony. If you know your cousin or your sister who lives here or a friend who has a small child, you should also ask them to submit testimony. And that way we can all together keep moving that needle. And when you do submit testimony, specifically for the providers on the call who are part of a subsidy program, right? They have parents who are on Care for Kids. We've heard, and Merrill kicked us off today talking about, you know, different ways that we're advocating. We've heard many times, many stories this year that Care for Kids has extreme delays, that it's very frustrating. Try to find ways in your testimony to share your truth, right? No one here is trying to censor you, but we want you to try to find ways to share your truth without seeming like a long list of complaining. And then that way, if you're connecting it to a bill, connecting it again to an ask, it's trying to help the legislator pave the way to a realistic way to fix the problem. For example, if I told a legislator every single day of session, Care for Kids is broken, Care for Kids is broken, they have a delay, and that's all I said. Again, like Merrill mentioned, these elected officials, they are listening to problems that are happening for all sorts of things. And their day job most likely is not a childcare provider. You know, you can have a legislator who's a real estate agent. You can have a legislator who's a lawyer. You can have a legislator who's a machinist. And they're not living and breathing what you do. They don't know, you know, exactly what a day in the shoes of a childcare provider looks like. So if all we told them was Care for Kids is broken, the legislator might not have time to figure out what is Care for Kids, what does Care for Kids do, how is it broken. We have to be very specific as to how we can fix the thing we're asking them to fix and why we need to fix it, right? We have to say Care for Kids is a subsidy, and I have all these parents who really need it because they're low income and paid us on time. That means I can keep my business open. And by keeping my business open, I'm able to really support the community I live in. So let's be very thoughtful on how you connect that story once more to a very clear request on their end.
So Ava, I'm seeing in the Q&A the question, if we have families interested in testifying, who do we direct them to? Do you want that to be you?
Yeah, I will volunteer myself. We have a
Okay.
team. So Childcare for Connecticut's Future is an advocacy coalition. And I would say, to avoid putting on the spot other nonprofits and organizations who do help in testimony, we are here to hold that hand with that person who wants to volunteer. So you can feel free to give them my cell phone number, my email, and then it'll either be me or Daniela or one of our Childcare for CT volunteers helping that person to get them to finish. And during this live call, that the first testimony we might be able to participate in is the appropriations at that, and possibly it's going to be the 14th of February. So Merrill and I were told that possibly the testimony for the education committee was going to be the 21st, 2 weeks from now. But usually these rumors are founded by some degree of truth. So if in fact in 10 days that will be the first hearing, then even more reason why we have to, take this weekend, take this week to write 1 page of what we want to say. And then if you need some hand holding on how to get you to that, to a formalized testimony, we are here. Let me know. And we'll make sure that we can take your personal story and put it in the context of actual testimony.
Yep. So we'll also expect that there'll be hearings in the Finance Committee to talk about the Early Childhood Fund. We are hearing that it will be House Bill 5002. That will be really trying to make the argument that we can't fix what's wrong with childcare without spending some money. And the state has so constrained itself with the fiscal guardrails that there isn't the money to spend through that normal procedure. So we're going to need to have a different route to be able to fund childcare. And when you look at how other states have done this, typically they've created a dedicated funding stream to pay for early childhood. In New Mexico, they have something called the Permanent Fund, which is based on revenue the state of New Mexico gets from oil and gas leases. And they did a constitutional amendment to their state constitution that dedicated a portion of that fund for early childhood. In Vermont, they created a payroll tax that's shared between employers and employees to fund a big expansion of their version of Care for Kids. In a county out in Washington State, they passed an increase in the property tax to do that, to do an expansion of childcare. And in Washington, D.C., they put a tax on the highest 2% of wage earners in like sort of create an extra category of their income tax to fund a fund to pay early educators better wages. So there will need to be some additional revenue. There are lots and lots of very rich people in this state. And what we've done is created a system of fiscal guardrails that essentially prevents the legislature from putting any further taxes on them, because we wouldn't even be able to spend the money. That's kind of the way that they've done it. So we need to be creative and think about how do we solve this problem.
There's a number of questions here, Merrill. Do you
Okay.
want me to ask you?
Sure.
Well,
Yep.
first, could you share the website to craft a story?
Okay, not
Someone
quite
was also
ready.
asking for the website for the Autocrat.
Okay, so Autocrat is an add-in to Google Sheets. So it's a way, what we do is we take a Google form that we create with a set of questions to prompt people to think about what they want to say. Then people answer in short paragraphs or long paragraphs, whatever. And then that feeds into a Google Sheet. Autocrat is simply like an old-fashioned mail merge where you put data that's in a particular field in the spreadsheet into the equivalent of a Word document. In this case, it'll be a Google Doc, so that we can set it up so you are answering questions and it's feeding into something that looks like the formal structure for testimony, where you have which bill you're testifying on, you greet the chairs of the committee and you thank them for the opportunity to testify. It says your name and where you live, and then it uses the paragraph answers that you put into your Google form to write your testimony for you.
Right. So people don't have to do any of that. That's the work we do on our side.
Right.
That's just to let you know how the system works.
We will be, if you're on the ECE info listserv, we will be pushing it out through the listserv. We can also do it through the coalitions list and the alliance list.
Yeah.
But what we need you to do in the meantime is to start thinking about who are those people with good stories to tell, either your own story or somebody you know. You know, those folks who have, you know, taken their kid out of your program because they've had a second child and now they can't afford to have 2 kids in childcare. And so, you know, that family, you know, that probably mom has left the workforce for a while. You know, even better if we got stories of moms who've left the workforce whose former employers keep calling them and asking them, when are you going to come back? We need that additional argument of the fact that Connecticut has a workforce shortage. There are thousands of positions that are vacant now because there aren't enough people in the workforce. And one of the reasons, particularly moms aren't in the workforce, is difficulty finding and affording childcare. So that's, yeah.
And then a request for those to also be in Spanish.
Spanish,
And
yeah.
We will do that, yes.
Yeah, yeah.
Okay, Eileen is asking if you know where the new bottle tax revenues are going, and is it possible to advocate for some of those going towards early childhood?
I guess
Bottle deposit.
I'll
It's
kick
bottle
it.
deposit, yeah.
I'll kick it off with Eileen. Our money is all put in the general fund. So if you hear bottle fund, if you hear CT lottery education money, if there's a new made up thing, it all goes to the general fund. There is no designated allocated amount of money in the state of Connecticut that is just for early education or our roads. It doesn't exist. Everything is one big pot of money, and then every 2 years the legislators decide what they want to pay, what makes more sense, who is more of a priority. And year after year, it's obviously not early ed. So that's what we're trying to change.
So the one exception to that is the quasi-public entity known as the Paid Family Medical Leave Authority. And they have a dedicated funding stream in the form of a payroll tax of 0.5% that everybody pays into it. And that enables the fund to have the money to pay out when people need to take leave, either because they themselves have gotten sick and can't work, or because a family member is sick, or has they've just had a child, or you know, any of the other factors that are allowable reasons to take leave.
Okay, Rhonda is wondering if we can have someone on from Care for Kids to come on to speak about process, application, paperwork, certificates, redetermination. I know that's something that we've been working on, so maybe you could just
on it, yes.
You've been working
Merrill
on
for the
you could
last
give
like
an
2
update.
weeks.
Actually, since before Christmas, we've been asking them to come on and explain things like the changes to the the protected status category of homeless children and how they're processing payments for DCF, foster children, etc. The one thing I could say with certainty is it won't be next Monday or the Monday after, because those 2 days are state employee holidays. And so we won't have folks from OEC on. In fact, I think we've decided that we're going to not have webinars those 2 weeks, next Monday and the Monday after.
We did get a call from Maggie last week to let us know that they're interested in doing a Monday Uncovered CT, collaborating with us to do a OEC/healthcare conversation. But whenever any of you on this call, any participant watching, we ask for ideas. They do not go on deaf ears. You guys have for the last 3 years, we deliver. We truly deliver topics that are thoughtful and are connected to your work. Merrill has been in contact with different OEC officials, like he mentioned, since before Christmas, specifically on the subsidy and the delays. It seems that they're just not quite in a position right now to come on and really deliver solutions. So it seems that we just have to wait a little bit of time to see when we have a date for them to come on and make the conversation worthwhile for them and for you.
Couple of comments here. Someone recommending Hector from Care for Kids, and another person complaining, or at least just stating, I should say, that Care for Kids is 3 months late. Okay, other questions here. This is a question that goes back to the maps. And Merrill, I don't know about the answer to this, but how does the capacity map information align with that new childcare desert information that came out? Because it doesn't appear to align according to this comment. Are you familiar with how those things, I know they did work with some of that data, but do you know how that worked?
No, I'll have to dig into those 2 different data sets and see where the discrepancies are.
Yeah, all right, sounds good. And I think that there was a question about what was being reported out on that capacity. Was it just licensed care? What was being reported out? And that discrepancy may also account for some of that difference. Do you know the answer to that?
The data source that the students used was the licensed capacity, both family and center. And the data on cost of care came from 211's survey, market rate survey. And it was, as I understood it, sort of data still in progress. I mean, that they didn't have all the data in, but it was what they had at the time that the students were able to use, because they had a deadline of getting the project done before the final completion of everything.
Yeah, and so it's all accurate. Can it be more complete? Can it be updated over time? Yes, but it is all accurate. All right, other questions here. Either Merrill or Ava, can you post in the committee chairs and committee members for education so that they can connect to their local legislators?
On that, Izzy?
Yeah.
Someone also asked to post today's YouTube channel on the education committee, and I just did that right now.
Great.
Okay, so the committee chairs for education are Senator Doug McCrory from Bloomfield and Representative Jeff Curry from East Hartford, Manchester. I think he's got a little bit of. You can find all of the members of committees if you go to the cga.ct.gov website and look at committees. And then in each committee, when you click on their little sort of committee web page, there's a list, there's a thing that says see committee members.
Thank you. Are there other states to compare Connecticut to?
Well,
I think this is back to the maps.
So Vermont has just in this past legislative session passed a bill to substantially increase the number of families eligible for their version of Care for Kids. It will be raising the income limits to, I guess, 5 times the federal poverty rate, or 575% of federal poverty rate. But substantially higher than our income limits are now. So that's one example. One of the other things that will be, we won't know whether it's real or not. The Blue Ribbon panel called for $55 million for an additional round of stabilization grants.
Apparently it was in the paper today at 100. Somebody posted in the chat.
Yeah, so there have been a bunch of different numbers floating around. In the fiscal year 25 budget that was approved last year in the last session, we increased spending on early childhood by about 47 million. And last week, the governor in a press conference mentioned that they were trying to double that. We won't know till Wednesday when we see the budget what that actually looks like. And that, there's the general fund appropriation, then there might be some one-time money of leftover ARPA funds that could get reallocated. And then there might be bonding that might be used for things like, capital improvements. We'll have to see the budget before we can actually tell you what's in it. And we don't have a Monday Zoom next week, but we may look at trying to, the Alliance might do a briefing for folks about what's in the budget next week. I have to figure out what's there before I can promise a briefing on it. But that'll all be in the ECE info listserv.
Yes, and as a reminder to folks, the next 2 Mondays are federal holidays. I think it's
State and federal. One of them is a state holiday and the other's a federal.
Excuse me, thank you. And then President's Day. And so we will have the next 2 weeks off in marking those. Then next week, Monday the 26th, we have Johanna Hayes on. And so that's, I think my guess is that we will also have information on the budget and legislative session. Typically, she wouldn't be on for the full time. So I believe we'll also probably have that ready to go by then. So stay tuned.
Yeah. So I was just going to say, the things to really watch for in this session are what will be in the governor's budget, how much of what the Blue Ribbon panel recommended for its first year gets included in that. And then the fight over sort of what's the most important stuff. If they say, okay, we proposed, the Blue Ribbon panel proposed 148 million and the governor is saying, here's 50 million. Which of the things that were proposed should that money actually get spent on? There may be different ideas about that, and we'll need to make our views known on that with legislators. Because just because a governor proposes, that doesn't mean that's what the legislature will finally approve. The next thing that will be in there as a big issue is whether or not the early childhood fund gets fleshed out to be a more real thing as a way to get some additional money to early childhood. In the Education Committee, we think that there will be a proposal around allowing early educators access to Care for Kids with an income disregard, so that Care for Kids pays the whole amount, and that it should, in theory, be easier to get staff onto Care for Kids because they wouldn't have to go through that whole income verification stuff. Yes, that might mean that there are 1 or 2 early educators who've got a spouse earning lots of money who would get free childcare, but we all know, unfortunately, the reality is that the vast majority of early educators are probably already eligible for Care for Kids because this industry can't pay people very much money.
Two more quick questions, and we're going to try to wrap it up by 10:30. Any update on ECE workers being eligible for state healthcare system?
I know that the union's doing a lot of work with that, and there's actually part of the union contract was an agreement that they were going to do a work group um, discussing how healthcare can be funded by the state for childcare providers. You know what? I'll reach out to the new childcare director, Adrian, to see what's happening with the work group and report back to see what those internal conversations look like. I could add that when Kate Farrar and other legislators that me, Merrill, and others have had conversations, it's on their radar. Healthcare is definitely on their radar. They've mentioned it to me, and I know to other lobbyists. So we'll get back to you, but that's a very good question.
And
And
then
the Blue Ribbon panel proposed a sort of healthcare light by putting in recommending that there be additional navigators to help early educators get access to the Access Healthcare system that includes both Husky and Covered Connecticut, which is the sort of in between, you know, not eligible for Husky, but not earning enough to be able to pay for childcare or pay for healthcare in the private marketplace.
final question. In the last 2 minutes, if you guys could, there's a few people in here who have said, what are the opportunities for in-person advocacy, either at the Capitol or elsewhere? And if you could maybe speak to the caucus, to the Morning Without Childcare, to other advocacy
Absolutely.
opportunities other than the hearings, the testimony, we've gone over that, but other opportunities that you two might have. Ava, you can start, and then we'll go to Merrill.
Yeah, so Merrill and I did lobby days. We did or we call them advocacy days last year, where we said, hey, come on this Wednesday and we'll be there, whatever time you want to come. And we divided the day in half. So like Merrill would take the early portion of the day, and because I'm a night owl, I took the night. So I stayed at the Capitol until 10 p.m. Whenever anyone wanted to come. So we were covering 10 a.m. night, so that way you give ample opportunity for any parent who has an odd shift, any provider who has to, you know, get out during maybe nap time to come to the Capitol or after work, that we really tried to make it convenient for you. I'm thinking, Merrill and I have not discussed this thoroughly, and I don't want to put him on the spot, but I'm thinking we should do something similar this year again, where we have advocacy days and we give you a schedule and you tell us what day you want to show up, and we'll connect you to legislators, hopefully your own legislator or the committee chairs of a committee of cognizance. Other opportunities, definitely Morning Without Childcare, April 10th. I know, Debbie, you put on the chat, is April 10th the day? The meeting to discuss if April 10th is indeed the date that we're keeping is going to be this Thursday. And I put the link in the chat if you want to be part of that conversation. If you feel very passionate about for it not to be the 10th, show up to the meeting. We work as a democracy, so people really get to select the dates and the locations and the details of that event. If you're interested in hosting an event on Morning Without Childcare in your town, you should also show up to that meeting this Thursday at 1:30 during nap time. Other opportunities, so you have advocacy days. They're most likely going to be Wednesdays. Wednesday is just the day that it's easier to gauge legislators being in the building. You know, Fridays, they're not always there. Wednesdays is a good day. It's also a good media day. If you want to testify in person for the actual hearings that are happening, let us know. We can also coordinate a time, meet you there, do some, you know, real support there. But that's pretty much it, Merrill, that we have right now planned, right? Advocacy days, April 10th, testimony for the time being. But we will discuss more things. I'm assuming we are just early.
Yeah. So the other event around, well, two other events. The Connecticut Project is doing a press conference about the kindergarten age on what day 15th? Is that? 15th?
The 14th, 15th? Let's see. Just going to go to my calendar. They announced it last week.
Yeah. The other thing that we know about is Dr. Dana Susskind, who is an audiologist. She does cochlear implants, and that led her to really look at the role of language development in children's development. She has written a couple of books, the most recent of which is called Parent Nation, which is really a call to make policy in this country similar to the more family supportive policies that exist in Western Europe, where there's a lot more support for families with young children. She will be coming and talking to the Early Childhood Caucus on the morning of February 27th, I think it is. Yes, Tuesday morning, February 27th, at 9:30 at the Legislative Office Building in room 2D. It will be broadcast on CTN, but for folks who have the option of coming, we would love to have a full room of early childhood advocates. We will be making a real effort to get legislators in the room that day so that they can hear the presentation live and ask questions. Kind of a good way to get more legislators committed to the Early Childhood Caucus and the work that we have in this session trying to move policy.
All right. Thank you so much. I think that is enough for today, unless you two have any last things you need to get out there. An hour seems like the right amount for everyone, unless we really need to use more. So everyone have a great next few weeks as this budget comes out and is able to be mentally and intellectually processed by everyone. Folks in the early childhood advocacy community, Merrill, Ava, and others will put together a list of talking points for you to use in any of your advocacy efforts this session. And if you are not subscribed to the ECE listserv, please do that. If you are a member of the Early Childhood Alliance, pay attention to those emails. Get on the email list of the Child Care for Connecticut's Future campaign. All of these places will be sharing out advocacy opportunities, calendars, talking points. And so stay tuned. And in the meanwhile, get your stories ready. And as you're talking to parents, flag them if you hear that they have stories that you think should be shared. Thank you again to Sandra for providing interpretation for us this morning. And thank you, of course, to all of you for being the reason that we show up every week. Have a wonderful 2 weeks, and we will see you toward the end of the month. Thanks.